Welcome back. You're watching The Front Row. Thank you for staying with us. So we're taking stock of how we've handled this pandemic so far, but most importantly, posing the question whether it is time yet to reopen the economy. President Uhuru Kenyatta, the last time he addressed the nation as far, on matters regarding COVID-19, put forth some restrictions that are expected to take effect till the 12th of March this year. That's about a month off. But currently, we are having a whole new conversation around the vaccine. But even then, there's an alert that was sent today from the ministry on counties, requesting counties to be on high alert due to the new COVID strains that we are seeing across the world. We're looking at South Africa, we're looking at the UK, Japan, you name it. Dr. Mwangangi, should we be concerned as a country with these new strains that we are seeing across the world?
I think the answer to that, Wandera, is that we need to be highly vigilant right now. Kenya stands at a risk of high importation of these cases, and that is why today the Ministry of Health issued a circular to county governments for them to be able to really be, exercising a sense of heightened awareness when it comes to the ports of entries, particularly counties that are at the border points, need to be a bit more cautious when it comes to different surveillance activities at the border. They need to be a bit more keen when it comes to temperature checks. We need to be a bit more keen when it comes to ensuring we're getting all the contact information that we require from our travelers. And when it comes to perhaps even advocacy in the community, awareness, adherence to the different protocols that we put in place, we are alerting county governments that they need to be a little bit more alert. Indeed, if these variants circulate within the country and, particularly at the community level, then this would definitely be something that we should be worried about. We've seen particularly the UK variant exhibits, some signs of, severe disease. The jury is still out on that. Scientists are still trying to curate the evidence. What we do know for sure is that the two new variants can be transferred or can be transmitted more easily. And because they can be transmitted more easily, it means more people would get, COVID. And of course, the larger the pot of people that you have, then the larger the number of people who could get severe disease. And so, yes, there's need for caution.
Looking at South Africa, it is this new variant that has seen them halt the whole process around using the AstraZeneca vaccine. This is the very vaccine we expect in the country, I think sometime this month. Correct me if I'm wrong. So then looking at how South Africa is handling this vaccine situation with the new strain and, finding out that perhaps it's not as efficient as they had anticipated, what is the plan with Kenya?
Things that we're doing is really relying heavily on our regulatory authorities, both within the country, but also outside of the country, and in particular WHO. And, we're waiting for more data to become available to be able to tell us really at the end of the day, what the utility of the AstraZeneca vaccine would be. One of the things that's happening in South Africa, and we're in contact with different, agencies there, is that they've halted the vaccination drive to then be able to get back to the table, come up with a new plan and determine, sort of the long-term utility of this. And one of the interesting things, and I'm happy that your reporter was able to pick it up, is that yes, indeed, the vaccine is less effective, almost by 40%. It's showing what we call 10% efficacy. However, the vaccine is still very useful because it's been demonstrated to show progression, to reduce progression to severe disease, meaning at the end of the day, this vaccine still has the capacity to reduce the number of people who require hospital admissions and therefore, protect our health system and avoid straining it. So it still has use. And because of that, we're still moving forward as a country. As we await new data and evidence to come into play, we are moving forward as a country, and that is one of the different vaccine platforms and candidates that we have as we deploy the National Vaccine Plan.
So when do we expect the vaccines in the country? Earlier on, the ministry said February. Perhaps you could give us the information, if you can right now, on when. And when you talk about, a less effective vaccine, are we doing our own tests here in the country to see whether we have our own new variants as other countries are discovering?
Yes, so one of the good things is that Kenya was one of the countries that participated in the AstraZeneca trial in Kilifi. We had different people enrolled into the trial, and they've gone through the trial with good results, particularly for the current COVID virus that we have in the country. In terms of deploying the vaccines, it's a dynamic sort of situation. In terms of resources, planning the logistics, thinking about the infrastructure, we all have that already ongoing, and there's good progress that has been made there. However, it's important for Kenyans to understand that the vaccines that we are getting as a country, we are part of a pool of a large number of countries. And so the determination of the specific date when the vaccines will land here is a fluid sort of timeline. It keeps changing depending on the different logistics, frameworks that are happening across the world, particularly in the COVAX facility. However, right now, tentatively, we do have, perhaps by the end of February, we may be able to have these vaccines available for deployment within the country. And we're pretty excited because really, as Prof has said, and also Dr. Ngani, the vaccine will bring new hope. The vaccine will perhaps inch us closer towards returning to, a new normal and living perhaps before, how we were before 2019 struck and 2020. And so there's hope in the vaccine. But then again, what you've asked is also quite interesting. Are we surveying, are we monitoring to see if we have those variants in the country? Yes, indeed, we are. We do have a team that is doing what is known as genomic sequencing. We have different labs collaborating, particularly focusing on any variants or any travelers that will be coming in through South Africa and the UK, and also in the general population. And we're able to pick samples and determine, are we having an increase in these new variants? So far, we have been able to identify the South African variant within the country. We've also been able to identify the UK variant. However, we're not at a threshold where we can say this is largely circulating within the community. And so we're still okay, we're still safe, but it's a matter, like I said, that really demands a lot of caution on our end and heightened surveillance.
Right. Prof, I'll pick it up from where you'd left it off. And on matters reopening the economy, even with the restrictions currently, we're seeing movement here and there of business. You say that things are starting to look up for a number of businesses. We're now on the road to recovery as far as the economy is concerned, looking at the stimulus packages by the government throughout the time. But how effective have this recovery strategies around the economy been so far? And what do we need to do?
That's a good question, because one of the dilemmas of coming up with a stimulus package, when you tell people that we are lowering their taxes, is that during such times of crisis, people are tempted to save money instead of using it. And that mutes the stimulus package. But I think it was a good idea from the government to come up with a stimulus package. But my personal feeling is that it was cut too soon. If I was to be asked, the government should go on with that stimulus package for another 6 months, because the growth we are seeing in the economy is because we are coming from a very low level of growth. So another 6 months of stimulus package would probably make a very big difference to the economic growth. The other thing we need to focus on as a country is, because the government and individuals have not been having money because of COVID-19, there is always a temptation to overreact. Maybe make the regulation so stringent, go after business people, go after traders, go after everybody, so that you can get extra money. And I think we should not go to the extreme just because we lack some revenues because of COVID-19. So the government should also help business people, the individuals, recover from COVID-19, because we are all in it together. Let's also remember that this is a global phenomenon. In the past, when Europe was doing well, it pulled us up. When China did well, they pulled us up. Now, because all the economies in the world have been having a problem, nobody wants to pull the other up. We are on our own. And that is why charity should start at home.
So then, and I'm glad you mentioned taxes, because even looking at some of the comments here, it would appear to be a very big thorn in the flesh of a number of Kenyans. A lot of the measures taken by the government to cushion Kenyans economically reverted at the beginning of this year, looking at taxes, looking at repayment of loans. They are back, but our economic situation is not back. Look at those who took pay cuts, but are now back to paying the same taxes. Look at those who lost jobs, but the environment is still not where it is supposed to be to enable Kenyans get jobs, do business and all that. Are they justified to then ask that perhaps lessen some of these restrictions for us to be able to move around and, you know, make money, for the money to work for us?
That's exactly my argument. There's no difference between December and January in terms of economic situation. So things are not changed so significantly that the stimulus package should have been done away with. If you look at a country like the US, they had a stimulus package, but when Joe Biden got into State House, not State House, but White House, his first agenda was to come up with a new stimulus package. That does not mean that the old one did not work. It still works. But the status of the economy is such that we need a new stimulus package. And I think that's what the Kenyans are saying, that looking at the state of the economy now and projecting to the future, then we need a stimulus package. In fact, one of my biggest worries now is the increase in petrol prices because of the global demand. And remember that petroleum prices have a very big impact into our inflation rate. So I think we need to start that conversation about having a stimulus package that should probably go for another 6 months. And 6 months is very generous. The truth is, the economy has not recovered as fast as expected. We are still talking about COVID-19. We're still giving data on people who have been afflicted by COVID-19. We're still talking about hospitalization. So the situation has not improved so significantly that people do not need a stimulus package.
Right. So then what should we do now? When we're talking about another stimulus package for the next few months, next 6 months, exactly what you say, perhaps just break it down for us before I go to Dr. Ngani. What is this the government needs to do to just ensure that they continue to cushion Kenyans for the next half a year or so?
I think it was, we had a very good package that was brought last year where there were tax reliefs. I remember that. And then something like VAT was reduced from 14, I think from 16 to 14. So we can have that reverted back. I remember the government made sure that, or gave an order that debts should be paid, because once people are paid their money, they don't keep it in their pocket, they spend it. And that stimulates the economy. The only brighter part, which I'm very happy about, is that a lot of government projects have been ongoing that has been creating demand and creating jobs. So let's look at it universally. There was also the case I remember last year of people getting stipends, particularly the elderly and the vulnerable members of the society. So we can get exactly the same package that we had last year and extend it for another few months. And that would be very fair to the ordinary people on the streets.
Right.
We don't need to invent it.
Okay. Yeah, just finish your point. Finish your point.
I'm saying we don't need to reinvent the wheel.
Okay. Perfect. Thank you. And I will ask you a question when we get back on whether really the government does what it's doing right now because it's caught between a rock and a hard place. That's another conversation I'm about to have with you. Let me bring in Dr. Ngani. You've been silent for a while now. Dr. Masi Mwangangi has talked to us about the vaccine. We are looking at whether to reopen the economy or not. Where are we currently? You work in hospitals. You say that we are still in a very critical stage, but we are seeing a lower positivity rate being reported, and especially in January, it's been oscillating between 4%, especially 3 and 2%. Would we say that we are on the road or to flatten the curve, or have we flattened this curve? Are we out of the woods?
Akisa, in December, it very much looked like it would be the case, and certainly the numbers in January weren't too bad, and to some extent, there's reason to be hopeful. But again, just if you share some of the discussions amongst doctors in different facilities, then you're beginning to see a certain creeping up of numbers. It's not dramatic yet, but then there's a certain trend that is different. At a point, we were not seeing, actually, you could go a couple of days without seeing a single COVID case, and suddenly now you're seeing more cases, some already going to ICU, and this gives us reason to worry. Indeed, the question about the new variants, yes, we know it spreads faster. Yes, there's no indication so far that it's more effective, more critical in terms of the disease it causes, but then it tells us that this virus is likely to keep changing. And you don't know what the next change is going to be. Maybe it's going to be a change that causes greater severity across board. And so, given that there are new things coming up every day, as it stands today, that's the situation with COVID-19, we need to be extremely cautious and extremely careful. We thank God that there's been lots of progress. Yes, certain measures Minister has put in place, government has put in place, have really helped us. But if we roll back some of these measures, there's a risk that we're going to have an exponential spread, and that exponential spread may come with a variant that will cause critical disease in many more people. Even though we are saying it's a small proportion that gets critical disease, 7% of 100,000 people, that's a big number of people. And it's important that we protect families in this way. We speak about the economy. The cost of treatment in critical care is one of those things that pushes family into economic hardships. You only have to have one patient in ICU to understand the pain of meeting those bills. And it's important for us to be each other's keepers and limit the spread.
All right. A number of questions here that I'm getting, and I think perhaps you could take a break, then come back with some of these questions and comments we are getting as we get back to the last part of this particular program. My director, Xavier, would advise on that, but then let's just take a look at a number of thoughts before we go to that. There's a question to you, Dr. Mwangangi, here on Twitter. Impact Borderless Digital asks that are you confident the needs-based COVID-19 testing adopted in Kenya is giving the true curve as opposed to the population-targeted spatial sampling in other countries? Note that on population-weighted tests, Kenya scores lower than Rwanda. I hope, Dr. Mwangangi, you've been able to put that question down on whether you're confident that the needs-based COVID-19 adopted in Kenya really is painting the true picture of our curve. A very important question that we'd like for you to respond to. There's another one from Betty Luta who asks, I would like to know why the Ministry of Health is not telling us where the testing is being conducted daily. We have a right to know. Dr. Mwangangi will also respond to that. And of course, we also asked Kenyans perhaps whether it's time, whether they feel it's time to relax some of the measures. Anthony Wahome says, maybe not yet. Kenneth Ludalo says, yes, the government has to do away with the curfew and let her leave as they do. And Godfrey Anzala says, Kenya has been busy copying strategies from developed countries for PR stunts. We are good in policies formulation, but not implementation. It's much hard to even use the numbers in Kenya because the figures look outright forged to suit agenda. Well, Dr. Mwangangi, I would like you to start with a question on whether the strategies we've adopted around testing are really painting the true picture of the curve and the infections across the country. Is it?
So, Akisa, I mean, I love that question because it actually takes me all the way back to a public health class. One of the things that we're doing right now as government is, yes, we're adopting a needs-based testing strategy. And this strategy has been adopted because we've sat down and we've looked at different parameters. Of course, the ideal situation, and this is really a question that has been present and valid since March when we reported our first case, the ideal situation in any country, not only Kenya, would have been to be able to test, each and every person within the population. And we're talking about 47 million Kenyans who are moving up and down and interacting with each other every day. The idea would have been to have 47 million tests deployed. But what the reality is, and for us to be perhaps pragmatic, and that's the key word here, is that it became increasingly clear, not only to Kenya, but to many countries, that we're not able to deploy population, mass-based testing across the countries because, one, there was constraints when it came to availability of the testing reagents, the testing kits, but two, also, when we looked at how this disease is, its epidemiology, with 93% of the cases being asymptomatic, then of course, the need to deploy a more pragmatic, rational-based testing strategy came into play, and that's what we are doing right now. And I must say, this is a strategy that we'll continue using going forward, and particularly because, one, we are focusing on those people who are symptomatic, those people who are presenting with, mild, moderate disease, because at the end of the day, the reagents, the testing capability, the logistic framework of all that continues to be strained. Number two, it's become increasingly clear that I can test you today and you will walk out and you'll be negative, but you'll interact with someone else and perhaps then become positive. So we're really being very pragmatic in terms of what we are doing. And beyond the PCR testing, and perhaps this is what the person who asked the question might not be aware of, is that we have different other surveillance mechanisms that we are utilizing in the country to be able to give us a true picture of the COVID situation. You may have heard of the antibody screening study that was done by Kemri Wellcome Trust a few weeks ago. This is perhaps their third iteration of that study, and that sort of tells us how many Kenyans have been exposed to COVID-19, and we were able to then determine what exactly is the scale of COVID-19 in the country, and particularly in urban counties, Nairobi, Mombasa, where we've had a lot of movement of people. Beyond that, we have a very robust surveillance system in our hospitals. We have close to 24 hospitals that are involved in surveillance of anybody who is presenting to the hospital with, an infection that affects their chest, with a respiratory illness. And we are able to then, of course, follow up these people and determine if this was a COVID case. And beyond this, there are many other measures that we are deploying to be able to get the true picture. So the counts that you hear every day, that is just one facet of being able to tell us where we are when it comes to COVID-19. There are multiple other surveillance mechanisms in play. And I like that you have today in your interview Dr. Ngani, and he can bear me witness. He works in the hospitals, I don't, but he can tell you that we're seeing reduced admissions. We're seeing all these signs that tell us indeed our numbers do tally with the situation on the ground. So yes, we're very confident with where we are with our curve. I think an important question that has been raised again is with regards to where we do the testing. This information is actually available and freely accessible in the Ministry of Health website. We have many labs, and each day, we keep on adding a new lab and another lab. My last count at a point was we had about 39 labs across the country that are conducting PCR testing. And even as we continue on, we are looking at new modalities of testing for COVID-19. You've all heard of antigen tests. You've all heard of antibody tests. All these are mechanisms that we're trying to explore to see how we can deploy this en masse within the country. And so indeed, the information is available, and we are happy to share that with you, Akisa. You could tweet it, you could share it in your Facebook profile, so Kenyans can be aware where these labs are.
Are we noticing any trends, any correlation between the laxity with observing these protocols and the numbers? Because on one hand, there is huge concern that Kenyans are not following the rules, mass gatherings every weekend. We're seeing parties every weekend, political gatherings, you name it. And on the other hand, the positivity rate keeps going down. How do we explain this? Is it a question of herd immunity that we are on our way to achieving? What is it, for the sake of our viewers?
So Akisa, that's part of the answer. Indeed, when we look at areas like Nairobi and Mombasa, we have noticed, these were the hotspots for COVID-19. And so, as expected, many, people were able to interact, and, community transmission was able to occur in Nairobi, Mombasa, Nakuru. And so, of course, most people have been exposed to COVID-19 in those areas and have perhaps developed antibodies. The key thing, though, to note is that the true story perhaps will be clearer 2-3 weeks from now. We know schools opened, we know people are interacting more, we've seen people traveling in matatus more without masks. So much like what Dr. Ngani said, we have our expert team of epidemiologists who are modeling, and perhaps a better picture will emerge within the next 2 to 3 weeks, particularly after the festivities, and we'll be able to, give you, a better answer, a more statistically significant answer to your question. But as it stands today, yes, in Nairobi, Mombasa, Nakuru, all the hotspot counties, there's a lot of interaction, and so there is an element of herd immunity, though we're not able to give you, a clear proportion of how much that has contributed to the current trend.
3 weeks, we'll see how that goes. I want us to take a quick break here on the front row. We're still answering your questions, getting your comments on the show. Is it time the national government considered some of the restrictions, reconsidered some of the restrictions like curfew? We'd love to hear your thoughts. The hashtag to use is front row. Text us on 22155. Tweet us at Akisa Wandera, at KTN News KE. I'm speaking to Dr. Mercy Mwangangi, Dr. Victor Ngani, and Professor XN Iraki, just giving us aspects of the economy and what we need to do. Let's take that break. We'll be back with more.